Hi everyone, I'm Leia May Villena from BSN 1201, and for today I will provide a pericare or perineal care to my client or to my patient. So the first thing to do is to assess the genital area or the perineal area and the extent of soiling, to search for any feces or urine that may cause infection and bring discomfort and irritation to our client or to our patient. And then determine the patient's level of capabilities to know the extent of help that we will give to our patient. After that, wash hands or perform hand hygiene to reduce the spread of microorganisms. And then prepare appropriate materials to be used. So our basin with water, basin with soap suds, cotton balls, alcohol, washcloth, bath blanket, bath towels, gloves, our rubber sheet, and our bedpan. After that, identify the patients to know that we are providing the procedure or the care to the right patient. And then explain procedure to alleviate the patient's fear and anxiety. So, good day, ma'am. I am Nurse Leia and I will be your nurse for today. May I know your name, ma'am? Okay, ma'am. So, ma'am, for today, I will give you a pericare or a perineal care. So, I will clean your genital area, your private part, for you to be more comfortable. Okay, ma'am, and also to search and assess for any abnormalities and unusual findings so that we can act on it right away. Is that okay, ma'am? Okay, and then provide privacy to our patient by drawing the curtains and closing the door. Then to show respect to our patient. And then after that, position the patient in a dorsal recumbent position to have a clear view of the area. So, ma'am, in a count of 3, I will just lift your knee. Okay, and a 1, 2, 3. On the other side, ma'am, 1, 2, 3. Okay, thank you, ma'am. And then, place a bedpan and a rubber sheet under the patient's buttocks to prevent the bed linen from soiling. So, ma'am, again, in a count of 3, help me raise your hip. So, 1, 2, 3. Okay, ma'am. So, again, ma'am, for the bedpan. So, 1, 2, 3. So, okay, thank you, ma'am. And then, after that, expose the area and drape the patient using a diamond drape. Then, so, put and then remove the top sheet. So we have to roll it over. Okay. And then fold the sides and create a diamond-shaped drape. So the diamond drape shape is used for female patients. So then rotate okay, and then secure both sides of the drape by wrapping it on the patient's legs and securing it in the patient's foot. Okay, and do the other side. Okay, now we have a diamond drape. Okay. Then after that, put clean gloves to prevent contact from body fluids. So we have to put gloves to prevent contact from body fluids. Okay. Then fix our gloves. Then after that, we can now perform the procedure. So okay, ma'am, I will now start, ma'am. So first thing to do is to flush water on the patient's genital area to remove excess vaginal secretions. Okay, after flushing water, put cotton balls in a basin with soap suds. And then, after putting the cotton balls, so we will now cleanse the area. We will begin to the vulva in the anterior portion. So, use one cotton ball at a time and then discard to lessen and prevent contamination. Okay. And then, using your gloved hand, gently separate the labia and then cleanse the labia majora and the labia minora. So we have to cleanse this area gently to avoid pressure and pain to our patient. So again, use one cotton ball at a time. So labia majora, and then other side, labia majora, and then other side, labia minora, then other side of labia minora. And then continuing to the clitoris, to the urethral meatus, and to the vaginal orifice. Okay, and then after that, we will flush again with water to rinse. Okay. After flushing it with water, so now we will pat dry the area. So, flushing it with water or rinsing will remove soap residue that may irritate the patient's skin, while pat drying will prevent the growth of microorganisms. And now we will wash the thigh area. So again, flush the thigh area with water. Then to the other side. Okay. So after flushing, use again cotton balls and soak it in a soap suds. And then one stroke at a time. So use stroke away from the perineal area to prevent contaminating the clean area. So stroke away, and then the other side, stroke away. Okay, and then flush again with water to remove residue. So after flushing with water again, pat dry the area. Okay, now, okay ma'am, so I will turn you to the other side to cleanse your anal area. So help the patient to position itself in a sideward position. So ma'am, on the count of 3, 1, 2, 3. And now we will begin to rinse the anal area. So because we do not have to flush water on the back part of the patient, we have to use our washcloth. Okay, so we have to pre-rinse the area, and then use the different parts of the bath cloth, of the washcloth on its area. So we have to use every portion or the clean portion of the area in every stroke that we will make to lessen contamination. So the stroke must be from the front to the back. So center, one, and then side, and then side. And then after pre-rinsing, use again cotton balls to wash the area. So, okay. Ma'am, I will now wash your anal area. So, center, then discard, and then side, discard, and then other side, then side. Okay. So, after that, we will not wash or flush the area with water, so we will use again washcloth to rinse the area. So again, use the clean portion of the washcloth in every stroke that we will make. So front to back, so center, and then front to back side, and then front to back other side. Okay, and then discard. Then after that, help the patient to position itself in a comfortable position, and then replace the bath blanket with the top sheet. So, ma'am, I will now place you in a comfortable position in 1, 2, 3. Okay, thank you, ma'am. And then remove the bedpan and the rubber sheet under. So, ma'am, in the count of 3, help me raise your hip so that I can remove the equipments under your buttocks. 1, 2, 3. Okay, ma'am. Then, to the other side, ma'am. another one, ma'am. 1, 2, 3. Okay, and then roll the rubber sheet. And then put it. And then after that, replace the bath blanket with a top sheet to provide warmth and comfort. And then remove the bath blanket under by rolling it. Okay. Then after that, okay ma'am, after that, remove all equipments, clean it, and put it in a proper place for the next use. And then remove and discard gloves and wash hands to prevent contact from body fluids or body secretions, and then to reduce the spread of microorganisms. Then after that, evaluate the patient's feelings and comfort. Okay, ma'am, how do you feel right now? Are you feeling more comfortable? Okay, ma'am, is there anything else that you need? No? Okay, great, ma'am. And then evaluate the area, the genital or the perineal area, for any unusual observations. And then lastly, record the procedure done and the pertinent observations like redness or swelling to provide an accurate data. And that would be all. Thank you.